Good morning.
Good morning.
My name's Janelle DeLumba. I'm the Director of PrimeWise and Volunteer Services here at St. Elizabeth. And I want to welcome all of you this morning to do you have ringing or buzzing in your ear? So hopefully we can all hear, right? We're here for a reason, but hopefully we'll be able to hear. I'm joking.
We're here, all right.
I'm joking. So what I do want to do is, I'm really pleased to have everyone join us, but this presentation is being recorded, which likely you heard when you joined. It told you that it was being recorded. And so what I want to do now, so I am going to be muting everyone. But we definitely want you to be able to ask questions, which is why I was suggesting the chat box. And the chat box is also I'm asking for everybody to write in their first and last name so I can check for attendance. Because if your first name is, Pam or if it's Janellen, there's probably only one Janellen, but if it's Pam or Sue or Kathy, there may be more than one of those registered. So I do appreciate it if you will give us your first and last name, and you can do that privately. You can select PrimeWise, that's me, that's my name here, PrimeWise, and type it in there so that not everybody has to know your name. So I appreciate that tremendously. That's a big help to us. And a little bit before we get started, I would like to do just kind of highlight a few PrimeWise programs that we have coming up. November the 3rd, we have a screening. It's called Managing Your Medications. And a pharmacist from St. Elizabeth, it's a one-on-one, so this is an in-person screening. And so you do have to make an appointment. It is going to be held at Fort Thomas. And this is an opportunity for you to put everything that you're taking, whether it's over the counter, it's prescription, it's a supplemental, anything that you are taking into a bag, bring it in and ask those questions that you want to ask your pharmacist, but there's always a line behind you at Kroger's or wherever you get your prescriptions. And you can sit down and ask those questions, and they can also give you suggestions of the best timing to take, or you shouldn't take this one at this one in the morning. It does better than at the evening, etc. So I encourage you to take advantage of that. On November the 9th, we have another virtual program. What matters most is what you want. And that is exactly correct. If you have not already completed an advance directive or a living will, this is a great time to learn more about that, because everyone who's over the age of 18 should have one. Not just those of you that are PrimeWise members. Everyone should have one. And if you've ever had the experience of having to be the person who has to make decisions for a family member, then you know how important it is to share what's really important to you. And so if that ever occurs, your family members know. So I encourage you to participate in that. And then finally, on November the 13th, our Cancer Center, along with an organization called Melanoma No More, are offering a free skin cancer screening. So if you have not seen a dermatologist in the last couple years, this is a great opportunity to have a dermatologist take a look at, that mole or that spot that you've been thinking about. Now, you once again must have an appointment for this, because this is in person. There are no walk-ins, and that will be on Saturday, November the 13th. So in order to make an appointment for either the November the 13th, the Managing Your Medications, or the free skin cancer screening, please call our office. And at the end, I'll have our phone number on the screen if you need that. So thanks so much for listening to my PrimeWise commercial. Once again, just as a reminder, I'm going to be muting everybody as you come on throughout the presentation. But I do want you to make sure that you ask our presenters questions. So that is why we encourage you to use the chat box. So you can type in your question. It is, however, at the end, we will have an open mic in which you can ask questions then. But as you're thinking about them, it's always good to get them answered as you're going along. So please feel free to type them in, and I'll be monitoring that to share it. And once again, if you're just kind of joined us, I am asking everybody to please type their first and last name, and anybody who might be viewing with you, their name as well, into the chat box. You can do that privately, so not to everybody, but to PrimeWise. So that's for attendance purposes. That's a great help to us. So it is my pleasure to introduce our two presenters. We have Dr. Eileen Gordon and Dr. Alex Markle, both of which are with Certified Hearing Aid Audiology Associates. Dr. Gordon received her Bachelor's in Science in Communication Sciences and Disorders in 2006, and then graduated with her Doctor in Audiology from University of Cincinnati in 2010. It was at that time that she joined the staff as Certified Hearing Aid and Audiology Associates. She works out of their Fort Thomas location. And Eileen, Dr. Gordon, lives across the river in Loveland, and she and her husband, along with their son and two daughters, are self-professed big sports fans, and they spend a lot of their time on the soccer fields. She's joined with Dr. Alex Markle, who received her Bachelor's in Arts in Speech and Hearing Sciences in 2015, and graduated with her Doctor of Audiology from The Ohio State University in 2019. She has been with Certified Hearing Aid and Audiology Associates since 2019 as well. Alex also lives across the river. She lives in Cincinnati, and when she's not working, she enjoys the great outdoors. So I am pleased to be able to turn this program on over to Drs. Gordon and Drs. Markle.
Okay, can everyone hear me okay? So I'm Alex. I'm going to start us off with kind of an overview of what tinnitus is. You can go on to the next slide. So tinnitus, it's commonly referred to as ringing in the ears, but it's really can be any sound that you perceive when there's no external sound present. So some people will describe it as ringing, other people will say it sounds like the cicadas outside, or a clicking, a buzzing. Even in some cases, people can perceive music. But again, it's any sound when there's no sound present. For some people, it might just happen for a few seconds, once a month, all the way on the other extreme as a noise that people hear constantly. And then just a quick note, we will call it tinnitus today, but both tinnitus and tinnitus are correct pronunciations of the word. Tinnitus is one of the most common chronic health issues. Over 50 million Americans experience tinnitus. Of those 50 million, about half report it being chronic or burdensome, and 2 million people report it being extreme or debilitating. Tinnitus is more common in men than women, and older adults are at the highest risk for experiencing tinnitus. Some high-risk groups include anyone who's exposed to noise exposure, so people in the military, hunters, musicians, or anyone who works in a loud environment such as a factory or construction work. Hearing loss is one of the most common causes of tinnitus. Up to 85% of those who report having tinnitus have some degree of hearing loss. And I want to point out that it might not be enough hearing loss that people perceive issues understanding everyday conversations, but it might just be kind of mild and those high-pitched sounds, but it's still causing the tinnitus. Tinnitus is also one of the most common side effects. It's probably on almost any medication that you could take. Tinnitus is going to be listed somewhere on there. But certain pills, antibiotics, water pills, certain chemotherapy drugs are known to cause tinnitus. Another issue, TMJ, that is one form of tinnitus that can often be treated. And then for a lot of people, there is really no explanation for why they have tinnitus. That's what we call idiopathic tinnitus. So there's a variety of healthcare providers who are involved in the treatment of tinnitus. Audiologists and ENTs are probably going to be the most common. So Eileen and I are audiologists, which mean we have a clinical doctorate and we're trained to diagnose and treat disorders of the hearing and balance systems. ENTs are medical physicians. They treat disorders of the ear, nose, and throat. Other professionals who might be involved, dentists and physical therapists, they're involved in the treatment of TMJ. So if you have tinnitus related to TMJ, you might be seeing one of those. Neurologists, they're going to treat disorders of the brain. And then psychiatrists, they provide cognitive behavioral therapy, which we'll get into a little bit later on. So there are a couple factors that can make tinnitus worse. Caffeine being a big one, stress, nicotine, aspirin. This is taking pretty high doses of aspirin every day. That's going to affect tinnitus, but it is a known stressor of it. The big one is also noise exposure, and this is something we can all do. Use hearing protection to prevent having additional noise exposure, which can make your tinnitus worse.
I think too with this, people look at it and, it's not something that we can say, if you eliminate caffeine, it's going to go away. If you drink a pot of coffee a day, maybe cutting back would help. But I think sometimes people think, well, if I eliminate, all of this from, my daily routine, what's going to happen is a lot of times the stress level goes up. And then again, it's kind of that, okay, now I've made one thing worse, even though I've maybe gotten rid of something else. So a lot of it is about kind of finding, a balance. Like Alex mentioned, the noise exposure type of thing is something that we can control. Some of the others, though, medications that you are on routinely, we can't just make that decision to say, okay, I'm going to stop that and, that'll take care of it. Okay.
I'm sorry. We do have a question that asks,
Sure.
Could you explain what TMJ is?
So TMJ stands for temporomandibular joint disorder. So this is when you have kind of long-term tension in your jaw, can lead to grinding your teeth at night, ear pain, jaw pain. That is what that disorder is. And that kind of tension in your ear and jaw is what can cause the tinnitus.
So in the ENT clinic, there are lots of times people will come in and report, ear pain. And when they, we think ear pain, people think, okay, I must have an ear infection. There must be fluid, something that I can take a medication for, and that will do it. But if they come in and the ear exam is normal, because your ear and your jaw are so closely related, it might appear that it's the ear pain, when in reality, it's actually your jaw causing that.
So if any of you have experienced tinnitus, at some point you've probably Googled it to see if there's any kind of medication or cure for your tinnitus. And as soon as you Google it, a ton of stuff is going to come up. Here are just some examples that I found, Ring Stop, Clear Tinnitus, Quietum Plus, they all have very catchy names. But at this time, there is no medication that has been shown to cure tinnitus. I'm seeing a question, is itching common with tinnitus? No, not necessarily. That would make me wonder if you had something kind of medical going on with your ear.
I was going to say itching, if it's something that's, all the time, It can be something as simple as, you can get dry skin in your ear like you can anywhere else on your body. So sometimes there's, an eczema or a dermatitis or something in the ear. Swimmer's ear is not necessarily only something people get because they were swimming. That's any kind of, outer ear infection where there is some drainage and things like that. I would say if someone has that they're dealing with all the time, they may pay more attention to that noise just because there's something else going on, but it doesn't necessarily mean the itching is what's causing that tinnitus. Another thing is we live in an area where, allergy and that is kind of all year round. So oftentimes if someone even has allergies that they're not totally aware of, that's something that they could potentially have as well.
Okay, so I'm seeing a couple more questions. Is surgery ever done in severe cases? So this was done years and years ago. They thought, okay, if you have extreme tinnitus, it's really debilitating. What if we just cut your auditory nerve? So you're not going to hear anything, but it will solve the tinnitus in theory. Well, unfortunately, by doing those surgeries, they figured out, no, that also does not solve the tinnitus. It's perceived higher up in the brain than the auditory nerve. So at this point, there is no surgical option for strictly tinnitus.
So another question, will it ever go away by eliminating things like chemo drugs, etc.? Or once you have it, it never goes away. So typically with like the chemo drugs and things, that probably is something where once it's there, because it's going to have likely some permanent hearing loss that has come with it. As far as, some patients will say, gosh, this noise started in my ears right after I had gone to go see a concert, and it rang for 2 days and then it went away. That kind of a side effect happens where, again, it probably doesn't have any permanent damage, which is why you maybe noticed it for a day or two and then it faded away. But things with more of, like I said, the chemo drugs, that's something where it's not just the drug itself, but probably, again, the hearing loss that comes with it.
And I do want to stress here, even though we say there's no cure for that chronic tinnitus, there are management and treatment options. So one of my least favorite phrases that people will say that they got told was, oh, you've got that tinnitus, it's never going away, and there's nothing you can do about that. That's not true. At this point, we do have some pretty good management options. The 3 we're going to talk about today, kind of overall wellness, and then tinnitus retraining therapy or cognitive behavioral therapy, and then sound therapy, hearing aids. So this general wellness section goes back to some of the things we've already talked about. So reducing your consumption of sodium and caffeine, like Eileen was saying, if you're having an entire pot of coffee, that can exacerbate your tinnitus. Stress reduction. So physical activity, exercising, doing the things that you enjoy doing are going to keep you distracted from your tinnitus. If you kind of wake up and you're having a bad tinnitus day and your immediate thought is, I can't do anything today, my tinnitus is so bad, it's going to prevent me from doing the activities that I love, that's going to increase your perception of the tinnitus. So keep doing those activities that make you happy. That will help reduce it. And then the third point, hearing protection. Again, we know noise exposure can increase your tinnitus. So anytime you're going to be working with power tools, mowing the grass, shooting guns, things like that, you want to make sure you're consistently using hearing protection.
And that's definitely something that we see and hear about, more often now. Before, I mean, we think back to even military, hearing protection wasn't something that everyone was like, oh, hold on, before I do this, I better put earplugs in. And now it's definitely more common. There are the earpieces you can find anywhere, Walgreens, even some hotels where they, roll up and you can stick them in your ear. Even something like that, when you're cutting the grass, is better than nothing. And there are lots and lots of different types of earplugs that, are custom fit to patients' ears. So if you find you have, a sensitivity and you feel like you can't keep earplugs in, there are lots and lots of options available for patients.
So this graphic here shows something that's referred to as the vicious cycle with tinnitus. And basically, there are two paths that can happen when you have tinnitus. The first thing, you might notice that it's there. Your brain perceives it as that ringing or cicadas, whatever it sounds like to you. And you can either go on this path of habituation where, okay, the sound is there, but it's not bothering me. It's just kind of in the background. The other path that can happen is it can be picked up by that limbic system where we perceive emotions. You can start having these thoughts of, this tinnitus is really bothering me. It's never going away. What do I do if it gets louder? And it creates this vicious cycle where that then ramps up the tinnitus. You're noticing it more, and it just kind of continues on and on until you break that cycle. And that is where something called cognitive behavioral therapy comes into play for tinnitus treatment. So cognitive behavioral therapy is usually performed by a psychologist who has additional training in cognitive behavioral therapy. And instead of focusing on changing the tinnitus, it focuses on changing your emotional reaction to your tinnitus. This is by far one of the most established and effective treatment options for tinnitus. There's very strong research backing up that this helps people cope with their tinnitus. It's been shown to reduce tinnitus-related distress, anxiety, and depression. And it works on replacing the negative and unhelpful thoughts that people have about their tinnitus and replacing them with more positive or neutral thoughts.
And this is something where, again, Alex had mentioned before, if you maybe notice you have it every once in a while, and it's just something where you may go like, oh, yeah, I guess I did have a little bit of that today, but it's not enough to, again, stop you and think about, okay, there it is. I know it's there. That behavioral therapy is not the step that you need to take. It's not that if someone feels like they have it, oh, I better, find a psychologist and have this looked at. This is, again, for more of those patients who feel like it is a big part of their everyday life.
Right. When it starts interfering with the things that you would normally do, that's when you start looking at these options. So here's some examples of common thoughts that people might have with their tinnitus and examples of things that they could change it to. So number one, tinnitus is ruining my life. So an example of changing a thought would be, okay, I've got this tinnitus, it's there, but I'm finding ways to do things that are important to me, even with the tinnitus. Another example is no one understands. And this can happen a lot with tinnitus because there is such a spectrum. Almost everyone has experienced some kind of tinnitus at some point in their life. So it might be something where you say to your spouse, you know, this ringing is driving me crazy. And they say, well, I've got that. It doesn't bother me. I don't understand why that is bothering you. So you might have that thought that no one understands. Instead, you can say, I can explain to people how it feels when they tell me they don't understand my tinnitus, and I'm learning who can be supportive. Another common issue, I can't sleep because of my tinnitus. So you might have this thought at night when it's quiet, tinnitus kind of ramps up. Then you start thinking, oh, I'm never going to fall asleep because of my tinnitus. It's going to make it go up even more. So instead, kind of changing that thought to, sometimes my tinnitus keeps me up at night, but no, most nights I do eventually fall asleep. Last one, what if it gets louder? Change it into, I'm learning coping skills to help me with the tinnitus I have right now. I can use those same skills if my tinnitus does happen to get louder.
And that all kind of goes back again to that vicious cycle where, you know, once it's there, it's about saying, okay, I know it's there, but what can I do to change this? If I can put it into the back of my mind, I can go on with that next activity, because it is that thing that, you know, if we sit in quiet and we start to notice it, well, the more I think about it, the more obvious it is. And then the more obvious it is, then we start to again think, how will, you know, I ever get rid of it? So, you know, it's something to think about. It's not something, you know, deadly. It's not something where, again, there's not any sort of treatment. So some of it is just kind of a mindset.
And then the third management strategy is the use of sound. So this can be anything from, you know, running a fan at night to keep that tinnitus down, to have a distracting sound in an otherwise quiet room. If you have tinnitus, I'm sure you've noticed that it does tend to seem louder anytime there's no other competing sounds. So this goes along with that idea of, okay, if you're sitting down to focus on something, playing low-level music in the background can keep your tinnitus down, using white noise machines or fans, things like that. And this is also where hearing aids get brought into the picture.
So our next part is going to kind of focus on the ear and how it works. And that we'll kind of go through the different types of hearing loss, signs of the hearing loss, and then we'll get into, you know, the treatment that is hearing aids, which again is going to be a huge part of what we see on a regular basis. How complicated that the ear is. And it shows how many kind of different components there are that go into hearing something as simple as a trumpet playing. So all along that system, there are lots and lots of places that there can be a breakdown that creates a hearing issue. So if we go to that next slide, we're just going to get into, again, a little bit of hearing loss and the different types of hearing loss that there are.
I just wanted to say that if you had kind of let me know, maybe we could have fixed that. Would you like me to try it again?
Oh, no, that's okay. I mean, honestly, we're going to get into, a little bit of, again, kind of some of the breakdowns. So it'll be plenty fine. Again, kind of the whole idea is sound has got to get through a lot of different things and structures before it goes to the brain. So hearing in general is a kind of complex process, which is why issues like tinnitus can be so big. So when you look at the picture that's up here, when we think of a conductive hearing loss, what that means is that something in that outer or in that middle ear, so before it goes to that hearing nerve, has some kind of issue, a blockage, whether there's fluid. This is something that's usually pretty treatable. You'll see one of the ENT physicians to, again, medically address it, whether it's a medication or one of the really common surgeries that we hear about, especially in little kids, is if there's fluid buildup and they need a tube in their ear, that drains the fluid and boom, all of that hearing is back to normal. So on that next one, you'll see the biggest thing people get in their ear is a buildup of wax. So we see that a lot where patients will say, oh my gosh, all of a sudden I'm noticing, the noise is, louder, and they may have a buildup of wax. And once that's removed, that may settle down a little bit. If someone has, an ear injury or something and gets hit on the ear, that may cause a hole in the eardrum and the little bones in the ear may be damaged. Again, some surgical may fix that, but it may also just be something where that patient is left with a hearing loss that can't be treated. And then again, even from birth, somebody may not have a fully developed ear, and that may lead to, again, a conductive type loss that would be there, for probably their whole life. So the most common cause of hearing loss is this sensory neural hearing loss. So this is going to be what we think of, as just what our body kind of naturally loses over time. This is a nerve type damage. And again, it is something where a lot of times it is just something where our body naturally gets this damage later on in life. Now, we definitely do see some 90-year-olds who may come in the clinic and they still have normal hearing. And then we may have a 25-year-old who comes in who has, a significant nerve type damage. So on the next slide, you'll see these are, again, a lot of the common causes that we see with sensory neural hearing loss. Aging being, again, number one. It's just, again, one of those things that as we tend to get older, more things tend to break down a little bit. Noise exposure will be huge, where again, if you're someone who's been in the military or who has worked construction, a good deal of your life, that noise exposure on a regular basis has a greater potential of causing this hearing loss. certain medications, again, like your chemo drugs and things like that, do also tend to have an effect. But again, there's always the give and take of what you can be on and what you can take yourself off of. Genetic causes are something where, we see a lot of a strong family history of hearing loss. And again, there are lots of studies that can look at genetics. But again, a lot of times patients will say, like, oh my gosh, yes, my dad had hearing loss, his dad had hearing loss, his mom. And so again, we see that kind of trickles down. Another big thing that we look at a lot now is how common there are a lot of different comorbidities with things. So hearing loss is twice as common in people who have diabetes. So the more kind of aware people are about, Janelle mentioned having like the other programs that PrimeWise offers with looking at medications and things like that. So there's lots of things that we're noticing can go hand in hand with hearing loss. So signs of hearing loss. I think probably the number one thing that once we have someone in for a hearing test that we hear is, I can hear that you're talking. I just don't quite make out what you said. And, spouses will come in and say, I say one thing and they give me an off the wall answer. Well, with that hearing loss, it's not picking up on some of the sounds and the clarity. Our brain tries to go back in and fill in for some of the blanks. Sometimes we guess right, and sometimes we don't. So, people will ask more often, if you could slow down, if you could speak once you have my attention. People who come in and they think they're hearing fine, but they may only have tinnitus. Again, that's something where we still want to do a test to look at, well, is there some underlying hearing loss as well? So just looking again at kind of long-term effect with hearing loss. And again, we don't necessarily just say, well, if you've got hearing loss, you're not hearing well. That's part of it. But that also affects, the ability of patients with their balance. There are 3 times more likely that patients who have hearing loss will experience a fall. We look at just the cognitive ability with patients, because you're hearing with your ears and your brain, that there is a 30 to 40% faster decline in individuals who have hearing loss versus their peers who have normal hearing. And a lot of what we see is the more difficult it becomes to hear, the less likely people are going to, continue to participate in things. If I'm not hearing as well, I'm not going to go there because I'm not going to hear anything. What's the point? Going back to that vicious cycle, then we see that untreated hearing loss can lead to depression. And again, it all goes back to that. If you're not able to hear and participate, people stop doing the things that they normally would. And that too has that connection with untreated hearing loss. Adults are more likely to develop dementia than not. So we look at, you know, the earlier detected, the better the outcome, as with really most anything health-wise. So it's really never a bad idea to just kind of get a baseline early. So tinnitus is really connected to, again, some level of hearing loss. However, they do not have to exist together. So even some patients who we do a test and they have normal hearing, they may get that noise every once in a while. But typically, if someone has a persistent tinnitus, it's again likely that they have some degree of hearing loss. And again, the hearing loss, because we're getting less of that external sound, because if it's not loud enough, we're not hearing it, then that causes our brain to change how we process those different sounds. So these are just, again, you know, we always want to see a little bit of humor in things. And we definitely have a lot of patients who have been pushed by family. So maybe they don't feel like they're affected, but the family is like, no, you really need to have that, you know, looked at. So we always joke there is no one who is ever running in to get hearing aids and have their hearing tested. But we hope that eventually the stigma on, you know, hearing loss and hearing aids will fade. So with hearing aids and tinnitus, so the idea with the hearing aids is something that we refer to as the masking effect. So a lot of times people are worried about, well, if I wear hearing aids, that's going to make that noise that I have louder. And it's really the opposite. So with hearing aids, you're getting sound that without them, you were not getting before. And what that does is it helps to basically take that noise that you're hearing and it kind of pushes it to the back so that now your focus is, oh my gosh, I didn't realize that that turn signal made a noise, or, you know, that bag crinkling has that, you know, scratchy sound. Your brain starts to pick up on other things. And that, like I said, helps lessen that noise that you're hearing. So it all goes back to, again, kind of increasing that stimulation that you're giving to your brain. Communication and, you know, participating in things, staying social. You know, if you were frustrated, you know, hearing aids can help bring it back to where it's like, okay, it's not so bad going there because now I am hearing better and I can have those conversations and participate again. Hearing aids can be programmed not just to improve hearing, but hearing aids can actually have a tinnitus function as well, where someone can wear them with a masker in it. So again, something that generates noise. So if you work in quiet, this will give you something where, again, you're kind of distracted in that quiet environment.
One example that people give a lot is thinking about a candle. So if you're thinking of your tinnitus as a candle, if you're in a dark room, that is the only thing you're going to notice is that candle. It's going to seem really bright. It's the central focus. But if it's in a room with a lot of light, you know, you might kind of see it in the background, but it's not going to be the main thing you're focused on. It's the same thing with hearing aids. They're just providing you a more rich sound environment. You're going to be focused less on the tinnitus because of that.
So the next couple of slides are going to be kind of quick and easy because these are just the different versions of hearing aids. So there's lots of different variety in hearing aids. So again, sometimes people who are going into this process, they don't want everyone to know that they have this hearing loss. So there are lots of different versions. And this first one kind of gives you an idea of what that looks like just to the side, but then also what that looks like inside the ear. And this is called an IIC, which is an invisible in the canal hearing aid. So this is going to fit down deeper into the ear. Still something the patient manages and puts in and out themselves, but it's going to be the smallest version of the hearing aid that there is. So the next one is a CIC, or a completely in the canal. And this one is just a little bit larger version than the one we showed before. So it tucks down into the ear, but again, it's not something that's very visible in the ear unless someone's looking.
Also, we had a question come up about tinnitus after the COVID vaccine. We are seeing this come up in ENT clinic. We're also actually seeing it after people experience COVID as well. I think it's still too early for them to know the exact relationship between the two, but I know there is research going on about that.
It's definitely, yes, definitely being looked at, but yes, I think just because it is still new, we don't really have, a lot of information on that. Some people have even reported it after like flu vaccines, things like that. Not something we would ever say don't do that for fear of it getting worse, but they're definitely looking into that correlation. You can probably guess these slides, we're going kind of up in size. So this next version of that hearing aid, again, is still one of the custom, meaning that the hearing aid is molded to fit the specific ear. So someone cannot just, put one of these in the ear and expect it's going to fit. It's something where an impression is taken, kind of like if you get a dental impression done, one of those is taken of the ear so that that hearing aid fits into every nook and cranny of the ear. Our next size up is this in the ear. And again, you can guess this is something that's just a little bit larger and fits into that whole outer portion of the ear. Behind the ear hearing aid is kind of two parts. And this is typically if someone has a much more significant hearing loss. This is kind of one of those power aids. There's a molded part that fits down into the ear, but then there is a part that also fits behind the ear, hence the name. So a receiver in the canal, or a RIC hearing aid, is hands down the most popular version of a hearing aid that we see today. And like the BTE, there are kind of two different parts. You've got a part that sits behind the ear, And then you've got a much smaller portion that fits down in the ear. And so as you can tell from that picture, it's really a very kind of discreet hearing aid. It's lightweight. And a lot of times when patients put them in the morning, they forget that they're there because of how kind of comfortable that is. So those are kind of the different, like I said, styles of hearing aids. And, you know, it's not necessarily the patient's job to know what is best. So, you know, honestly, with technology, hearing aids are essentially a laptop computer. So it's possible that almost any style of hearing aid can be fit to a hearing loss. And again, that's our job. You know, we want to help patients understand, you know, what their hearing loss is, but then also we're going to lay out all of the options so that you can figure out, okay, what's going to fit my lifestyle best. Some of the things that help us kind of identify what is going to be best is sitting down and talking to a patient. So figuring out what are the things that you struggle with on a regular basis. You know, do you have dexterity issues? If you have numbness in your fingers, you know, changing a very small battery a couple times a week is not necessarily going to be the most helpful. It's going to be more stressful. So finding out kind of what options are available and what a patient wants to get from their hearing aids, again, whether it's just to treat the hearing loss or if they need something to help treat that tinnitus, is what helps us figure out what's best. And again, the size and shape of someone's ear, as well as how much hearing loss they have, that all can affect what goes into a hearing aid fitting. So hearing aids have come a very, very, very long way since, you know, some of our, you know, parents and grandparents who used to wear aids, and they were just the big ones that, again, everybody saw and they whistled and made noise. You know, the new hearing aids, because they are digital, they do so much more. You know, they have rechargeable batteries. So there's no changing a battery, just like your phone. You plug them in every night, you're ready to go. The hearing aids can do Bluetooth. So you can answer phone calls and listen to music, you know, through your hearing aids. They can connect to your television set. So again, if you always feel like you want more volume, but everybody in the family is happy, you know, a TV streamer can help kind of give everybody what they're looking for. You get your own volume, you're not blowing anybody else out of the water. And again, even our smartphones, we can download an app and you basically have a remote control right in your pocket. And, you know, it's not that this is for everybody. You know, so again, figuring out what are the biggest issues you're dealing with, that's what helps us figure out the best solution. Some people say, I want to put a hearing aid in and not think about it. That's an option too. So when to schedule an appointment? So really, any time that you feel like you're noticing that you're not hearing as well. Things are muffled again, or gosh, people are constantly looking at me like, where did you come up with that answer? You know, that's a sign. Have it looked at. It may be that just everyone wearing masks makes things more difficult, and your hearing may actually still be great. But again, there's never a bad time to at least get that baseline to figure out where you are. And again, if tinnitus is something that is really bothering you and you're noticing it's there daily, it's definitely worth looking into it. Some of the red flags with our ears where, you know, a hearing test may be necessary, but seeing an ENT for some medical advice is warranted, is if someone says, you know, I have it, but it's only in one ear. Or, you know, gosh, I can't talk on the phone with my left ear. I always hear out of my right ear better. Or if someone says, gosh, I woke up and I am just plugged on this side and I'm not hearing anything. Ear pain, you know, dizziness. Those are also things where getting a hearing evaluation is necessary, but also to see one of the ENTs is going to be huge. And our day is half and half with seeing hearing aid patients, but then also working with the ENTs in clinic for, again, hearing test, balance evaluations, things like that. So more and more and more, we are seeing, you know, over-the-counter hearing aids. I can go into Walgreens and there's an amplifier. You know, how to know where to go and who to see. There's a lot of things to consider. What we are most proud of is, again, as an audiologist, our education and our background is in treating, you know, the hearing loss as well as, you know, the patient themselves. It is not a, you know, sale, but it's a, how can we help make that quality of life better? We have lots of locations and multiple providers so that we can, again, it's not, oh, if you want to come, you have to go here. We've been around since 1985. And again, we have lots of different offices for convenience. Customer service is huge with us. If anyone has an issue, we do have audiology assistants who are available for walk-in service. And again, these are things where we just want to make sure that the patient feels like you're taken care of versus, you know, Costco or something where, again, you get hearing aids the same place that you buy your groceries and toilet paper. So insurance is something where we're getting a question about that. And that's something where Medicare itself does not cover hearing aids at this point. It is not the best news, but we do always call to verify for patients to see if there is any kind of insurance coverage. You know, certain plans, they will have discounts and things like that available. And again, sometimes patients are not sure where to turn or what questions to ask. And again, that's where one of our audiology assistants can help figure out, you know, what does your plan cover? And is there help on the cost?
The hearing exam is typically covered by insurance. Medicare does require a referral from a primary care physician to cover the hearing test. But yes, with that referral, it is a covered benefit typically.
Yeah, just not the hearing aids. Although, like I said, that is definitely changing as more and more people kind of lobby for that. Discomfort with hearing aids and glasses was another question that has come up. So there are lots of different adjustments on a hearing aid that can be made to make sure that that fits comfortably on your ear and your head, so that it's not something where, oh, because you wear glasses, you can't wear this style. So it's something very, very common. And typically there is always a workaround to make sure that somebody gets what's comfortable for them. So this is just, again, a little bit of information about us. So we are located in Fort Thomas, Edgewood, Florence. And then we do also have a part-time location where we are out there 3 days a week in Lawrenceburg. The phone number directly to our hearing aid side of things is this 859-344-4440. And again, that's the easiest number that goes straight through to one of our audiology assistants versus playing the on hold game. So this gets you directly through to a person. And then these are just a couple of the different resources where, you know, they have good reputable information about, you know, tinnitus and, you know, a lot of where we pulled our resources from. So that's kind of, you know, that in a nutshell. Are there any questions that we didn't either cover in the chat or that anyone can think of now?
Yeah, any other additional questions?
I know it's a lot to take on early in the morning.
All right. If just kind of while you're thinking of some additional questions, you may remember from the PrimeWise update that there would be appointments available for individuals who attended or participated in this presentation for a free hearing screening. And so that was one of the big reasons. It was very important for you to put your name into the chat box. And I think there's only 2 participants here for which I am uncertain who they are. So thank you all for doing that, because you will want to call that previous number, and which
Yep,
we will
that's
send out in
exactly
an
that.
email.
That's the best number to call. Yep.
That will be the number that you will call. And while you're anxiously writing that down, you will receive a follow-up email either later today or tomorrow. And that will include this presentation that you can, as well as their number within the body of the email. And very importantly to us as well, there will be a Surveymonkey link for our evaluation. So we will be asking you to please, oops, that did something. I was just trying to move it ahead. So it will be a Surveymonkey link for you to complete an evaluation for us. I do see one more question. What is the average cost of aids?
So this definitely kind of depends on a lot of things. So hearing aids have what we call different levels of technology. And so, you know, a basic hearing aid is designed to, you know, amplify sound, make conversation easier to hear. But that person doesn't say that they're in a lot of background noise. So they just need that power and that's it. The more variety of environments patients are in, they need that hearing aid to not only help improve speech, but also to filter out some of the background noise, because they're going to tell us, you know, I'm really active and I'm in groups and restaurants, crowds all the time. So it depends on kind of where somebody falls on that spectrum. but they can go anywhere from, you know, $3,000 to $6,000 for a pair. That's where our pricing falls. Now, again, that doesn't take into account if there are any discounts or insurance benefits, things like that. And then also the way that our services are run is that the hearing aids, as well as programming, follow-ups, counseling, you know, walk-in services, all of that are part of it. So if somebody is purchasing hearing aids and then they wake up and they're like, oh my gosh, I don't know what happened and this isn't working and, you know, I need someone to look at it. Coming into the office is something where you're not going to pay to have someone look at it. That's going to be something as part of what you've already taken on so that we can get you working and doing well.
Great
But
question.
it's definitely something where, yes, you will see lots and lots of different pricing. And again, the more and more that we see, you know, online stuff and commercials for, you know, oh, buy a pair for $399. And, you know, you're going to see lots of things like that. But typically, again, it's going to depend on what's all included with that.
Great. So really, on behalf of our PrimeWise members, Drs. Gordon and Markle, we thank you for this interesting and enlightening presentation. Very, very helpful. So we wish we could see you. We wish you had turned on
I was going to
camera.
say, our video wasn't working.
So we do thank you. Just as a reminder to everyone who is still on here, I already mentioned this, but we'll be sending out an email, and within that email, it'll be very important to us for you to click on the link to take the Surveymonkey evaluation for us, provide us with your feedback. It will include a copy of this presentation, so you will have that phone number. And within the body, we will also have the phone number that you can go ahead and set up that free hearing screening included in this presentation. Now that is only for people who participated today. So once again, hopefully you put your name in the chat box so we know exactly who participated. We really appreciate that. For those of you who would like to stay on, I will replay that video that you could not hear. I believe
perfect.
Happened. So if you would like to stay on, I will go ahead and do that. But outside of that, we thank our presenters and we thank those of you who participated, and everyone enjoy the rest of their day while I go back and find out how to do this presentation or do the video.
Wonderful. I was going to say, I would imagine if we just copy and paste that link just into, you know, a web page, that should pull it up because it was working before.
It's only because no one told me you couldn't hear.
Oh, okay. Okay.
If you'd have told me that, I could have fixed it.
Well, and I was going to say, and I don't know.
Yeah, that's okay. Where is it? I missed it.
Yep, there we go.
So I believe. And everybody, so you need to tell me this time around. Can you hear it?
Yep, there it went.
Have you ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates 3 tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
Let's see.
There it went, and my video came up. It wasn't coming up before, but it came up now. So someone had typed in a question about how do we know with, if it's hearing loss or something else. So typically the hearing exam is what will help us look at that. So if someone has that tinnitus present, but we do a hearing test and the hearing test is normal, again, then we can look at, is it some other factors? Again, a bunch of medications will have that on it as a side effect. And again, if the hearing loss itself is not there, again, that's a great baseline. So then we have that for maybe in a year. If we look at that again and see, were there any changes? Are you noticing your symptoms have gotten worse? Are they happening more often? But a hearing exam is, again, at least a good way to establish that baseline. Not everybody comes in and it's like, oh, yep, you have to get hearing aids. Even if you have a little loss present, but you feel like you're doing well enough in managing it, and again, it's not happening that often, we're not going to just say, well, yes, you have to get hearing aids and that's the only option. Sometimes it's just peace of mind and knowing, oh, I may have a little bit of hearing loss. That's probably why I have a little bit of that noise. Again, comforted, understand it. And then again, in a year, maybe we look and the same thing, we kind of just monitor and see where that's at.
Excellent information. Anybody else?
It's a crazy phenomenon. That is for certain.
Well, if there are no other questions, once again, everybody, we wish you a great rest of your day. Thank you for participating. Look for that email. And our huge thanks to both of you, both of our presenters. Thank you very much.
Absolutely. Thank you so much.